90. What foods and activities should the patients be told to avoid when receiving antihypertensive medications? The answer is, the foods and activities that the patients should be told to avoid when receiving antihypertensive medications are: avoid high sodium salty foods, avoid alcohol, avoid activities requiring alertness, expect DT and hypotension or drowsiness. 91. What are some discharge instructions and warnings to give to a patient taking antihypertensive medications? The answer is, some discharge instructions and warnings to give to a patient taking antihypertensive medications are: only take what is prescribed, avoid hazardous and alert-needing activities, avoid alcohol, stay hydrated, follow the diet, change position slowly and dangle feet at the edge of bed before rising up. The warnings to give to a patient taking antihypertensive medications is to take what is prescribed, avoid activities, avoid alcohol and drink water instead, to stay hydrated and well nutrited by staying on the diet, and change position slowly and dangle feet at the edge of bed before rising up. 92. What instructions should be given to a patient who is receiving procainamide pronestal orally? The answer is, the instructions that should be given to a patient who is receiving procainamide pronestal orally are: take with a full glass of water, take with or without food, and do not crush. 93. Which condition would contraindicate the administration of methyldopa-aldimate? The answer is, the condition that would contraindicate the administration of methyldopa is renal or hepatic impairment. Renal is kidney, and hepatic is liver. So the condition that would contraindicate the administration of methyldopa is renal or hepatic impairment. 94. What is hemostasis? The answer is, hemostasis is stoppage of bleeding. Hema means blood and stasis means standing. Hemostasis means stoppage of bleeding. 95. What is a thrombosis? The answer is, thrombosis is a stationary blood clot. Stationary means it does not move, so it is stationed, which means thrombosis are blood clots that don't move but can block blood flow. 96. What is an embolus? The answer is, an embolus is a blood clot. The blood clot is carried through the circulation to some vital organ. 97. How does the PT check a patient for home and sign? The answer is, the PA tech can check a patient's knee for home and sign. There is an extended position and the examiner forcefully dorsiflexes the patient's ankle. The foot is flexed upwards. If there is pain in the calf, then the result is positive. So the home and sign is checked in the patient's ankle. 98. What laboratory tests are usually ordered for a patient on warfarin? A. Blood tests, PT for prothrombin time, INR for international normalized ratio, guaiac and hemical to check bleeding in stool and urine. 98. What laboratory tests are usually ordered for a patient on warfarin? A. Blood tests, PT for prothrombin time, INR for international normalized ratio, guaiac and hemical to check bleeding in stool and urine. 98. What laboratory tests are usually ordered for a patient on warfarin? A. Blood tests, PT for prothrombin time, INR for international normalized ratio, guaiac and hemical to check bleeding in stool and urine. 99. What are some of the complications of warfarin? The answer is, some of the complications of warfarin are that it interferes with the clotting mechanism of the blood, so there is prolonged bleeding time. Warfarin messes up the clotting mechanism, which leads to prolonged bleeding time. 100. For what reason should the patient notify his dentist regarding warfarin therapy? The answer is because of increased risk of prolonged bleeding. So think of a patient notifying his dentist about warfarin therapy because in war you bleed out. Therefore notify the dentist about warfarin therapy if there is an increased risk of prolonged bleeding.